most women are concerned about their aging skin. There's tons of information out there on the internet, in magazines. A lot of times also they put these pictures on the internet of before and after that you think is something of a novel. So we are here to dispel some of the myths and answer 4 important questions that we get asked a lot. I'm with Dr. Angela Serum. She is a prominent facial plastic surgeon in Houston. And me, Christiane Waldron, I'm the owner of Genetica Skincare. So before we go on to asking all these questions, I'd like to talk to you about us a little bit so you know where we are and who we are and where we come from. So first and foremost, Dr. Serum, please tell me about yourself a little bit, how you got to be here. We're in her practice, so let's talk a little bit about this wonderful location we're in.
I am from a small town in West Texas. First one in my family to be a physician. My dad's a farmer. So got out of the small town, came to Houston.
Wow.
I'm an Aggie, went to A&M for undergrad and came to Houston for Baylor for medical school and for my training. Fell in love with facial plastics when I saw them make a ear for a child out of a rib. Thought that was the best day you could possibly have, is to create an ear. So I just fell in love with the creativity and the positivity and the way that we can impact people's lives.
That's awesome. How long have you been a plastic surgeon?
About 4 years.
Okay, and what is your favorite operation?
Rhinoplasty.
Rhinoplasty, okay. Yeah, we all need to look pretty, right? And about me now, I am Christiane Waldron. I'm a scientist. I'm a chemical engineer, actually. I graduated going on 20 years now. It's been a while. And about 4 years ago, I was in the biopharmaceutical industry for a long time. I made vitamins. My specialty really was taking small recipes and bringing them to the commercial scale. And I don't know, something got to me, and then I decided I wanted to start my own skincare company. My philosophy is very simple. I worry about, we have an anti-aging skincare line. So I worry about aging. I try to incorporate a lot of really food for skin. So I try to feed your skin from the outside in, and then you try to help us also from the outside and from the inside somewhat. So that's me. I am also based in Houston, and we have a wonderful line. And we're going to start with the first question now. That, again, we're going to talk about a lot of the questions that both Dr. Angela and I get asked a lot. So first and foremost, we seem to come around the subject a lot, brown spots.
Yes.
Dr. Serum, what is your take on brown spots? But let me opine. Let me talk first about brown spots. So brown spots, I'm always intrigued that a lot of women ask me this question, how do I take care of brown spots? And a lot of women tend to be very surprised that, all of a sudden they're in their late 30s or early 40s and they're getting brown spots. And I always tell them, did you wear sunscreen when you were a kid? And a lot of women my age, and I'm in my 40s, didn't do that. We actually did the opposite. We put lotion on our face to get a tan. I'm a child of the 80s, of course. So as a result, 20 years later, you start seeing the incidence of brown spots. Sunscreen is very important to prevent the formation of brown spots. In a topical skincare line, really what you want to look for, I really enjoy an ingredient called Arbutin. It's a shrub, and it's the natural hydroquinone. So if you don't want to go with the hydroquinone alternative where you have to go to the doctor, I would look for a serum that has a lot of vitamin C, a lot of Arbutin. There's, as you age and you want to prevent the formation of brown spots, it's very important to use a serum or a day cream that contain a lot of vitamin C and a lot of Arbutin. So ask the question at the counter when you go to the skincare counter. And also to wear sunscreen. 30 plus? Do you agree with me? 30 plus is it. So tell us a little bit about some of the procedures that we can do if we were to come to your office to get rid of some of the brown spots.
There's different levels of things that you can do, starting at the lower end as far as downtime. You can do things like IPL, it's just like a lunchtime laser. It's very little downtime, works on brown spots, red spots, helps stimulate collagen.
How many times IPL?
It's 7 to 10 usually.
Okay, 7 to 10 times?
Yeah.
Okay, so you have to come at a certain frequency?
Yeah, because it's not as intensive a treatment, and so you need more times to be able to see a result.
Yeah.
Then you can step up into your more medium range, which would be your non-ablative lasers, kind of like your Fraxel. Those would be safe on all skin types. So
Somebody like me who's got Mediterranean skin, you would recommend a Fraxel?
Mm-hmm.
Okay.
Yeah, you get the best of both worlds. You can help your skin tone, texture, brown spots, all these good things. And then as you go up higher in the intensity of the lasers, you can have ones that are specific for brown spots, and so they're picked up specifically by the pigment. It doesn't affect the skin around it, but just those.
So if you had large brown spots, you would recommend that kind of a laser.
Right.
And is that more of a downtime?
Yeah, because you can have some crusting and blistering and things like that, and so you want to make sure you don't do that before a big event.
So for those, you really want to focus on, sometimes you get a big one around a certain area, so that might be the best for that, right? Okay. And then I guess after the procedure, what do you recommend? Continuing to wear sunscreen and continuing to do products that lighten and whiten the skin, I guess?
Right. You always want to, protect your investment at that point. Do your sunscreen, like you said, at least SPF 30. The lightening creams and incorporate a whole skincare regimen.
Yes, that's important. I love skincare regimens too, and I tend to really worry about, as I age, the problem with brown spots is they tend to make you look older than you truly are. And so really you need to focus on not only taking them away, but also preventing future discoloration. And I tell my clients and women, every day you're in the sun that you're not wearing sunscreen, there is a potential for a brown spot to appear a few years down the road, unfortunately.
Right.
Okay.
And some of those brown spots could be skin cancer, and so you definitely want to be careful about that.
So what would you do with those? I mean, preferably you would go to a dermatologist to get those checked
Have them
out?
checked out, and then as far as removal, it could be a dermatologist or a plastic surgeon, whoever you're most comfortable with.
Okay, so a doctor could diagnose that. If you want to talk to any of us, we're going to have our email in the bottom. This is Dr. Serum. She's a Houston facial plastic surgeon, and I'm Christiane Waldron, the founder of Genetica Skincare. Please watch our other videos that are going to be coming up very shortly, and thank you for watching.